So today we're going to be looking at cranial nerve assessments. I'm going to start with cranial nerve 2, which is the optic nerve, and that is a sensory nerve. Then we're going to look at cranial nerve 3, ocular motor, which has a motor component. Then we're going to move into the trigeminal nerve, which is cranial nerve 5, which has a combined sensory and motor component. And then lastly, we're going to look at the accessory nerve, which is cranial nerve 11, also a motor component. Hi, my name is Jessica. I'm a student physical therapist. I'm going to be working with you today. It's nice to meet you.
Nice to meet you.
So I'm just going to start with a quick test of your eyes.
Sure.
Okay? You probably had this done with the eye doctor before where they shine a light in your eye.
Mm-hmm.
Okay. So I'm just going to do a quick look. So just look straight ahead for me. Okay. So right now I'm just looking to make sure that her pupils are round and symmetrical, which they are. Okay. So now I'm going to place my hand here.
Sure.
Okay. All right. Now I'll just try to stare straight ahead. Okay. So I'm going to move that in front of your eye. Move that in front of your eye. Good. So when I'm doing that, I'm actually looking at both eyes. I'm looking at her left eye for what we call a direct response, and looking at the right eye for a consensual response. A normal response would be a pupillary constriction bilaterally. Abnormal response would be if one of them did not constrict, stayed dilated. Okay. So next thing I'm going to do is called the swinging test. So I'm going to swing that light in and out, in and out. Okay, we're going to do that both sides, in and out. In and out. And again, looking to make sure that those pupils constrict bilaterally, which they should. She has a normal response, so that we would say that her pupils are round, symmetrical, and reactive. Okay? All right, so let's move on. We're going to move on to the sensation test of the next nerve. Okay? So normally you're going to do this test with like a cotton ball or something that's actually going to give like a softer component. For the sake of this video, I'm just going to use my fingers. Okay? All right, so what you're going to do is you're going to tell me if you feel this movement. Okay? So, can you feel that?
Yes.
Can you feel that?
Yes.
Can you feel that?
Yes.
Okay. Can you feel that?
Yes.
And that?
Yes.
And that?
Yes.
Good. So now we're going to look to make sure that they're both the same from side to side. So now you're going to tell me if it's same or different, okay? Same or different?
That's the same.
Same or different?
Same.
Same or different?
Same.
Good. So this one right here is the ophthalmic branch, this one is the maxillary branch, and this one is the mandibular branch, and those are all sensory parts of those nerves. So finally, we're going to do the motor component of the mandibular nerve. So I'm going to have you do is you're going to open and close your jaw for me. Good. Okay. Now I'm going to put my fingers right at the masseter. Okay, open and close. Good. Okay. And then go ahead and open into my hand. Good. And rest. Good. So for that, I'm just making sure that those muscles are firing appropriately. You want to make sure that there's no deviation of the jaw to one side, and make sure that there's no pain associated with that as well. Now back to the sensation testing, if any of those were abnormal, I would also do a sharp test by using like the head of a paper clip to see if there was any pain associated with that, but hers were normal, she had normal sensation bilaterally. All right, and finally, what we're gonna do is cranial nerve 11. So again, this is a motor component. We're just gonna do a manual muscle test of the upper trap and the SCM. Have you shrug your shoulders for me? Good, and back down. Okay, go ahead and shrug again. Don't let me push you down, okay? Hold, 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 hold. Good, okay. Now I'm going to look at the SCM, which is a contralateral rotator. So go ahead and rotate to the right, and then rotate to the left. Okay, good job. All right, now you're going to rotate to the right for me. Don't let me push you to the left. My hands are cold, I'm sorry. Hold here, hold, hold, hold. Good. Okay, and then turn the other way. Hold here, don't let me push you. Hold, 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 hold. Good. So basically we're making sure that that SCM is firing nicely, and again we want to make sure that it is symmetrical. If there was any weakness, there might be a problem with the muscle or with the nerve itself. So